Okay, so we're going to be doing some basic blister care for a blister that has ruptured. And I'll draw on the blister right there so you can see it. And we're returning this person to work after doing our blister care. So first things first, some PPE and cleanliness. So I'm going to wear gloves for part of it, and then wash my hands for part of it as well. So first off, I'm just going to use some rubbing alcohol or whatever product you have, and a swab to just clean around. Obviously, if you use something like alcohol on the blister, it's going to hurt a lot, and some parts of this will hurt a bunch anyway. So cleaning the surface, making it better for adhesives to stick to. Alright, now I'll wash my hands. And we can start working. So if you have a ruptured blister with ragged edges, you can use your scissors to snip and smooth the edges, make sure that dirt doesn't get in there, cause more infection or scalpel. If you don't have a ruptured blister, then you can drain it, get rid of the pus inside with just a standard syringe and needle. And trick for people who don't mind a little bit of pain is to then inject either some skin glue or Fire's balsam in between the layers of skin, and that just seals it right back together. Let's not do that for Josh, because it hurts a little bit. At this point, you'd put a little bit of polysporin or whatever antibiotic that you're using on the open skin of the blister, and I'm going to use my tough skin around the blister just to put a little bit on to increase the adhesive. So after that, I'm going to cut to size a piece of my moleskin, and you got to pay special attention to the contours of the skin. So big thing that blister care sometimes fails to do is to prevent future blisters. You want to make sure that you don't have edges or raised surfaces that are just going to rub and cause a blister elsewhere. So for him, I'm going to be particularly careful of his heel area and then where his malleolus meets. So I'm going to approximate, fold over, and I'm going to make my little blister circle in the middle. So that should fit right about there. And the hardest part is getting this backing off. And all this is creating a surface for your sock and your boot to rub on that isn't your raw skin of a blister. So I'm not encroaching on any physiological formations here, and the blister is within that little area. If it's a big blister, or if you don't think it's going to be enough, you can put another layer of moleskin on to get that raised surface. Then I'm going to put a little bit of fluff, so a little bit of a cotton ball or something on the blister itself to just add a little bit of padding. It'll stick there a little bit better with your polysporin, and that'll cover it up to start with. So if your tough skin isn't enough, you can add just a little bit more here and there. Make sure that the tape's going to stick. And then the taping is the most important part, because it's the part that often causes extra blisters. So I've got just some skinny tape and some thick tape here. I'm going to be taping upwards so that the motion of the shoe against the tape doesn't strip it off. I'm not going to be taping side to side, so that I can contour with the heel and also make sure it doesn't peel off. So you can make a bunch of strips in advance, which I'll do now. Okay, so we've got some strips pre-made for narrow and wide tape, and we've got the skin glue on there. So over bits that are going to be a curve, I'm going to use the narrow tape so that I can make sure I get around those curves without causing extra edges. and I'm going to overlap by half. So if you get a wrinkle in the tape, that's just going to cause another blister, so there's no point in even taping at that point. So it's important to use these small bits of tape. And then when you get to a flatter surface, like I just did, then you can move to the larger bits of tape, because they work better on a flatter surface without getting wrinkles.